Hello everyone, Vanessa here from Progressive Periodontics and Implants. I am one of Dr. Pick's dental hygienists. I'd like to invite you to a series of educational videos that we have branded our Hygiene Connection, where we will discuss the importance of your oral health and the role that it plays in the oral systemic link and your overall health. What exactly is the oral systemic link? It has been said that the mouth is the gateway to your overall health. More and more medical and dental professionals are finding this statement to be so very, very true. Your mouth will reflect what's going on with your body's health, and vice versa. Your body will reflect what's going on with your oral health, hence the oral systemic link. These educational videos will explain the link between your oral health and how it affects your body from head to toe. June has been labeled Alzheimer and Brain Health Awareness Month. So to kick off our educational videos, we are going to explain the link between periodontal disease and the health of your brain. What exactly is periodontal disease? Periodontal disease is an infection of the soft tissue. If left untreated, will eventually cause harm to the hard tissue, the jawbone in your mouth, and could eventually lead to tooth loss and other serious illnesses. What are some signs and symptoms of periodontal disease? Red, swollen gums, bleeding when you brush and floss, bad taste in your mouth, bad breath, just to mention a few. Statistics have shown that over 47% of adults over the age 30 present with some form of periodontal disease. The actual percentage actually rises as we age. 70% of adults over age 65 present with some form of periodontal disease. That's a lot of infection. Also, through research, it has been shown over 50 million people worldwide, now this is worldwide, present with some form of Alzheimer's or dementia. That's a lot of disease. So from our end, we just find it vitally important to help and enable our patients to be as healthy as they possibly can to prevent other systemic illnesses. So there were studies that were conducted where they worked with 6,000 patients that presented with Alzheimer's and dementia. And they focused in on 19 different types of bacteria that were found in the oral cavity. One of these bacteria is a leading bacteria in the cause of gum disease. It is called Porphyramonas gingivalis. I'm going to refer to that as P. gingivalis as we move forward because it's a mouthful. P. gingivalis is found in high levels in patients that have active periodontal or gum disease. But what is the risk, what is the danger that it poses to our patients? We know that when P. gingivalis travels through the bloodstream, it releases a toxin throughout the body. And what these toxins do is they actually release a protein, a beta amyloidic protein that clumps together. When these proteins clump together, they can deposit plaque on the brain. Now, this is a different kind of plaque that we refer to in the mouth. Plaque that we refer to in the mouth is actually colonies of bacteria. So the plaque that forms on the brain from these bacteria that travel through the bloodstream are actually proteins that come together and then they deposit a plaque on the brain. There are 3 different mechanisms on how this bacteria can get into the body and reach the brain. The first mechanism is the bacteria actually crosses the blood-brain barrier. And when this happens, it releases those toxins that forms these proteins, and then they deposit the plaque on the brain. The second mechanism is when this bacteria enters the bloodstream. Now, this bacteria can enter the bloodstream simply through brushing, flossing, eating. When this bacteria enters the bloodstream, it causes what we refer to as a systemic inflammation. And again, from this inflammation, these toxins are released, these proteins develop, and the plaque can develop on the brain. The third mechanism is when this bacteria travels through the bloodstream, it can actually attach to the blood vessel wall or the arterial wall, weakening these walls, which can lend to increased possibility of a patient having a stroke, which then leads to vascular dementia. So you can see how vitally important it is to keep the amount of bacteria low within your mouth, just to protect your body and promote overall general better health. And it's so important for us to ensure that our patients are healthy and enable our patients to live a long, healthy life. So we hope you find this information beneficial. Please feel free to pass these videos along to friends and family members, as we want everyone to live a long, healthy life. Our next video will focus on the link between certain cancers, periodontal disease, and also its link to rheumatoid arthritis. Until then, please be well, and we look forward to seeing you and your beautiful smile in the office. Take care.